Hi, my name is Brad Siff. I'm the founder and president of BioWave. I'm really happy to be able to start our webinar today. The topic's going to be focused on recovery and rehabilitation, how the use of high frequency peripheral nerve stimulation is helping athletes return to the game quickly and safely. I'm really excited to introduce our guest lecturer today. His name is Nathan Wilder. Nathan is Senior Associate Athletic Director for Sports Medicine and Performance at Towson University in Baltimore. Following the presentation, in about 20 minutes or so, we will have a live Q&A session. So please click on the Q&A button in the bottom right corner of your screen, and we'll be happy to answer any questions that you have.
Thanks, Brad. It's a pleasure to be here today to talk to the group about my use of BioWave and how we integrate that in our athletic training facility at Towson University. So just a little bit about me. I've been practicing as an athletic trainer, and I have strength and conditioning coach credentials for past 27 years as a performance specialist. My education, I started as at Waynesburg University in Pennsylvania and finished up my bachelor's degree, and then went on to Ohio University with a master's degree. Primarily, my responsibilities over my career have been around, student athlete health and well-being and performance enhancement within a football group. Currently, I'm the Senior Associate AD for Sports Medicine and Performance at Towson University. I've been in this position 11 years. And overall, I've really experienced a lot of medical care from the high school levels, D1, 2, 3, colleges, and even NFL athletes. So like I said, I specialize in really acute and chronic injury treatment and rehabilitation and around football athletes. So a little bit about treatment philosophy that I undergo in my practice and that we really do here at Towson University is really a neuromuscular rehabilitation approach. So this incorporates a lot of facilitated exercise and dealing with inhibitions around injury. As a lot of you may know, in an acute injury situation, pain itself is going to create an inhibition around surrounding muscular tissue. Inflammatory mediators are going to also contribute to that. So really, we're trying to minimize those things and then bring our neuromuscular system back online to make our athletes stronger, faster, and sometimes even more perform better, even better than they were prior to their injury. So this has been pretty much a fundamental approach for me across my career. I haven't used a lot of modalities in my time. When I say fundamental, I would stick to a lot of ice and heats and things like that. And I really haven't even used electrical stimulation that much. Because I haven't found it to be that effective. But I will say that when I was introduced to BioWave and on its inception, it did change the way I think about electrical muscle stimulation. Basically, I feel that this device has changed kind of the environment which we use it to really aid in providing an overall initial treatment course to change the environment for therapeutic exercise, meaning that in the acute injury process, if you can find ways to make the athlete feel better and work through their limitations, they tend to respond better to therapeutic exercise. And then we can really bring that neuromuscular system back online to help these athletes perform at the top level. So typically what we see on a regular basis, in a football setting, and this applies to a lot of other sports, but my experience is in football, but really it's acute and chronic pain syndromes. Those range from fractures, sprains, strains, contusions, et cetera. Low back injuries. A lot of times we have, football athletes, especially offensive linemen who are, lifting heavy weights and working in the trenches, and they end up with low back pain, et cetera. So, really the application here with BioWave is from all levels. I mean, there's not really one particular area you can use it on, but really when you have pain and you evaluate that the student athlete is in discomfort and is not able to work in a level that you want them to because they're inhibited by pain, this is a good opportunity to use BioWave. So I use patient-rated outcome measures on a daily basis. We are collecting that from a functional standpoint and a pain management standpoint. We monitor the pain on a regular, daily, in and out of treatment sessions. I think it's really important to remember that pain is subjective, and that means it's different for every individual. Some athletes are going to be in significant pain and be very limited in what they can do. Others will have minor pain, but at the end of the day, we understand that in an acute injury or sometimes even chronic injury situation, it's that pain syndrome that inhibits them from being able to do what they want to do. So we naturally need to treat those goals. When we see those in a patient, we want to make sure that we're going and attacking that immediately, and it's able to help us aid in the overall treatment protocol in rehabilitation. So BioWave is definitely an effective modality to use during the acute inflammatory process and also into subacute phases of tissue health. So we kind of stretch the use of BioWave from the very early onset of an injury, usually at day 0, right as that injury occurs, all the way through that acute and subacute phase of healing. And we try to, make it easy for the student athlete. And there's a lot of pros and cons to using modalities, but in this case, I think BioWave does a great job of giving us a landscape to really have continual treatment. BioWave also offers long carryover effects that really help student athletes have lasting pain. I feel like in my experience, this is what has changed the game for me in using this device, is that the technology that is developed and how it works really allows for some, endorphin release and longer carryover effects. I find that the athletes just feel a lot better after their treatments versus, that pain returning the minute they're done with their treatment. So typically in our facilities, we're using BioWave, on the regular. Like I said, typically it's around the time that they have, I'd say 15 to 30 minutes. We usually set our intensities. We really have the athlete take it to tolerance as much as they can handle on the dosing standpoint. Sometimes as their pain changes, they are able to increase their intensity and get more efficacy out of the modality. We've also used it in conjunction with other modalities, such as using it with ice and heat. Again, from a fundamental approach, I would say prior to BioWave being on the market, I was simply using, conventional modalities of ice and heat and didn't use a lot of other electrical stim or other ultrasounds or things like that. I feel like fundamentally the ice and heat does a great job for pain management, but now with the addition of BioWave, I think we're getting a better environment. We're getting a better efficacy and result from the treatment plan. So typically, as we go into our evaluation and we're setting goals for our patients, our overall goal is just to reduce pain and give them the opportunity to work through other therapeutic exercise. Like I mentioned before, the long duration of pain relief with a 30-minute treatment is really great for subacute and chronic injury. Using an example of, say, someone with like a patellar tendon issue in basketball, or even in football, we see that a lot due to excessive squatting in the weight room, et cetera. But this chronic injury, typically applying BioWave will give them some carryover effects that helps them get through their workouts, gets them through their practice, et cetera. And we've also been able to use this in conjunction with range of motion and sometimes even strengthening exercises to able to work through function in a pain-free range of motion. So usually BioWave will mask, any of that pain that they're getting at certain ranges of motion, et cetera. Other benefits that we find is really just it's user-friendly, right? I mean, the market has changed, and from the initial onset of the BioWave larger box, having the home and the go units have been very instrumental in making sure that those student athletes can get treatment anywhere they go. And it's really important that they don't have a whole lot of things to set up on the device, which I think is another real benefit of the unit itself. It's easy. They plug in, they learn from us as the medical provider how the pads are fitted, they learn how to apply and prep the pads, but then they also go ahead and just hit the button, turn it up to their desired intensity, and then they run their treatment. We've been using this, at home with people, as they come out of the facility after injury, taking it home, using it 2 to 3 times a day. After that, we were using it in meetings. We've used it on bus rides. We take it on away trips with football, et cetera. And again, with the electrode placement being right over the pain site, it's easy for the student athlete to find that. And ultimately, it's a very comfortable and treatment that does excellent job of really reducing pain, and the patients are very compliant with that. So overall, it's been very positive for us at Towson University. So I wanted to go through just a couple examples of cases that we have used this on. In this first case study, I find that really superficial joint structures, the AC joint, for example, in the shoulder, is a really great application for this. The AC joint tends to be kind of bony. It's one of those injuries that even in minor severity, it has a significant amount of pain. Those injuries that are grade 1 and grade 2 sprains of the AC joint tend to be pretty symptomatic, and they either come with loss of motion or not. And ultimately, it's not so much the joint structure, but just the pain that allows those athletes to not be able to do a whole lot, and it keeps them out of play. So this example, we had a 19-year-old quarterback who was sacked, and ultimately their shoulder was, had took a direct blow from the ground on the anterior and lateral aspect of the shoulder. On a initial evaluation on the sideline, they had a lot of pain over their AC joint. They had some difficulty moving the shoulder. This was the throwing shoulder for the student athlete. They were, taken to the side. They were evaluated by an athletic trainer and team physician and diagnosed with AC joint injury. X-rays were ordered at the time to rule out any kind of fracture to that joint. And then we started treatment pretty much right away. So this injury was acutely managed. This person had some limited range of motion, some pain, and typically on the very, maybe days 1 to 0 to 3, if we need to, we immobilize just to let things calm down. I mean, in this case, would I say that they had to be immobilized or splinted because their injury was that bad? The answer is no. But ultimately, I think allowing this injury to rest and to treat their pain acutely, conservatively, will turn them around faster, and we can then get more aggressive, a few days down the line. So we actively manage this in a sling with pain management, i.e. using BioWave directly at the AC joint site. So the presentation of the student athlete was just a chief complaint of pain and at the AC joint. They rated their pain with that patient rated outcome at 6 out of 10. They had a limited range of motion to 120 degrees of flexion and abduction. So they really didn't have full motion at that time. They couldn't get their they had a painful arc. Once they got to 120, they were really struggling, kind of maintaining full motion. So, and ultimately that pain mechanism resulted in weakness in the shoulder itself, in flexion and abduction, and also that rotator cuff. Because of pain itself. Obviously, there wasn't a lot of muscle damage or anything, but just the pain had limited them. So ultimately, our goal was to get that taken care of. Our goals, as we went into our treatment plan, were really just to decrease pain at the injury site, increase their range of motion, and maintain their strength so that they could get back to sport as quickly, as safely as possible. So what we did was we started acute management, again, like I said, with BioWave, ice, and immobilization. We asked that the individual use ice 2 to 3 times a day, as well as BioWave. We treated them acutely in the athletic training facility. We sent them home with a home exercise program as far as icing, 20 minutes on, 40 minutes off, and then making sure that they were using BioWave. They had at least 2 to 3 treatments that evening around their icing cycle. So as we progressed through that first 3 days, we continued to use BioWave in a subacute sense, but we switched ourselves from an icing modality to a heat modality just to bring additional blood flow to the area. And we also then started the range of motion process. Like I mentioned, they had a limited range of motion at about 120 degrees. So we started working through range of motion just to create mobility at the shoulder joint, as well as using the BioWave to help that pain management along the way. So we really have 3 applications there. Initially acute pain management, then obviously into the subacute stages, just to continue with some additional healing, but then also then working into the rehab process. So great application there. With a BioWave setup, I mean, there's a select electrode that you place right at the AC joint. We place the other electrode on the spine and scapula. That scapula pad typically is a little bit bigger than the one at the AC joint. And what we found in this care was that pain was reduced initially by 30% after the first day with 3 times of use. I mean, that athlete significantly had their subjective pain questionnaire was less, like by 30%. At day 3, as we started to move into this range of motion and started maintaining strength, the athlete was reporting about 50% deficit and improvement, not deficit, but improvement in their subjective pain scales, and their range of motion was improving as well. So I really feel that, like, again, cutting off that pain cycle with BioWave gives us, the ability to create the environment to move through the rehabilitation process much quicker. As we moved into our rehab focus, we initially started with isometric work on the table. This might have been around day, 4 or 5 of this injury, in a supine position. So they're laying on their back, and we would work more manually in an isometric functional position. Again, we did this in conjunction with BioWave so that any type of contraction at the deltoid area that would potentially put some stress at the AC joint, it would minimize their pain. So they're feeling the sensation of the electrical stimulation versus actual pain that they have from the injury. And then as we move through that process, moving them from the table to more of a conventional strengthening program, we continued to use BioWave to mask any discomfort from that 0 to 90 position as that AC joint was continuing to heal. Again, this is probably moving into about 7 days post-injury. Once they have a subjective pain scale that's within normal limits and back to baseline, we discontinue the use of BioWave. Sometimes our student athletes like to just ask if they could have it, at the end of their rehab session for, just kind of their own psyche. I think at that point, the medical indication might go away, in the sense of, because we have achieved a pain-free range of motion, and we're able to continue strengthening in a much more general strength and conditioning way. But again, the athletes enjoy the experience with BioWave, so they ask for it typically, post rehab. Can I get that again, or can I do that at home later? Those are some things that they usually ask. So, and then following, that, like, when this athlete gets back to play and they're back and they're healed and they're back to full function and they're returning to play, it's typically, okay, post practice, I'm done. I'm a little sore from practice. Can I have BioWave at the end? And we usually oblige at that point. Sure. And we're not too specific about, the actual protocol at that point. But again, I think it's one of those devices that the student athletes kind of become accustomed to and really enjoy. The second case study that I'd like to bring up is more of a chronic condition that we use it for. And again, it's another superficial joint with not a lot of, soft tissue over it. So using it for turf toe, which is basically a chronic sprain or inflammatory response of the first MP joint in the foot. And we had an athlete who's a 20-year-old college football player with a chronic turf toe injury, which is a sprain due to they had that in high school. So this kind of bothered them in functional activity. So this person really wasn't limited in the sense of their practice time, but they did report that some activities caused discomfort in that MP joint. So presentation, again, there's some chronic capsular thickening of that due to previous sprain. Mobility was slightly limited and sore and passive toe extension. Their pain level typically with exercise was 5 out of 10. And mainly their chief complaint was just that push off, any type of acceleration or deceleration where they had to push off their toe was uncomfortable. So in this case, our goals were to try to get them to get through practice with a minimal pain and also just maintaining overall function. So again, applying BioWave to this area was really the protocol was more of a pre and post practice usage of that. So any type of discomfort going into practice, we would apply BioWave 30-minute treatment. And what we were trying to do there is really try to achieve those long carryover effects with the endogenous opiate release of in the joint and making sure that they could get through. So this individual was able to apply a 30-minute treatment prior to practice. We would do some joint mobilization to increase their motion. We did have some additional supportive devices. We used their steel plate in their insole, as well as taping to make sure that there was some limitation in that extension that caused them some discomfort. But overall, the use of BioWave pre-practice caused a 60% reduction in the person's subjective pain during a 2-hour football practice. And what we're seeing is that post-practice, they might be, they get through practice, they'd say, I'm a little sore, so we would do the treatment again. And that kind of helped them carry on the rest of the day in their normal life, But function was able to be maintained without any limitation, and this person was able to get through. So, really 2 examples of how this can be used in an acute setting and chronic setting. And I would also like to just add that, regardless of the injury, sprain, strain, fracture, dislocation, contusion, et cetera. I mean, there's a wide array of body parts that the BioWave can be used on. We definitely use it on low backs a lot, with more of a chronic low back pain setting. We use it in the knee area as well, just medial lateral joint line for chronic knee pain, acute knee pain, MCL injuries, et cetera. Post-surgical pain management as well. Someone's coming out of surgery and they've got a lot of acute pain, and that typically lasts a little bit longer because of the surgery. We're using it in those ways as well. So it's just in quick summary, the benefits of BioWave, use of a high frequency peripheral nerve stimulator has been a game changer for us. I think it's just created an environment where we have athletes asking for the big blue box. And now the big blue box is a lot smaller and can go anywhere, put it in their pocket, take it on the road. I mean, it's been great. We've been shown to reduce acute and chronic pain and allow for greater function, following participation. And like I said, to reiterate what I've emphasized, is that especially in these superficial joints where we can really turn up that intensity and get some good pain reduction. We've been able to show that there's longer carryover effects with this treatment. And there is a cumulative benefit of multiple treatments per day, or even home care usage, et cetera. So I really do feel, as a professional, that the unit itself and the technology that drives the pain management facilitates an environment for the athlete to really complete fundamental therapeutic exercise, whether it be range of motion or strengthening, in conjunction with an electrical muscle stimulator pain management system. And ultimately, it's very easy to use for the student athlete, and they just keep coming back for more. So at this time, I will take some questions. And I thank you again, Brad, for giving me the opportunity to speak about our experience at Towson University.
Nathan, thank you. That was a great presentation. We're going to do the Q&A session now, and some questions are starting to come in. The first question is, what are some other applications in sports where BioWave can be used?
Well, thanks, Brad, for being able to share this information. I shared the 2 protocols that I use, as examples. I do think that the BioWave has, various applications in all injury parts, body parts, injury types, et cetera, in sports. I in my presentation outlined the need to use it for pain management in acute and chronic situations, but I've also have been able to use it in conjunction with rehabilitation. I think that anytime that an athletic trainer or any type of clinical provider needs to manage pain in order to get people moving and doing more motion and activities that it can be applied. You can use it on the ankle, you can use it at the knee, you can use it at the hip, you can use it on muscle tissue, you can use it on bone tissue, you can use it on, you know, ligaments, tendons, etc. So I feel like really there's endless opportunities, and I think it's important for the clinician to use their creative, art in their practice to make sure that they use it again to manage pain.
Okay, great. Are there particular parts of the body, like a couple other examples, like in terms of applications, like have you used BioWave for ACL sprains or for post-op ACL rehab?
We've used it again for pain management acutely. So any knee injuries, ACL rehab, we would use it coming out of surgery for pain management. What we like to do is try to get the individual, obviously right out of the gate, they probably are on medication. We want to wean them off that medication as soon as possible. So we use BioWave in conjunction with that, where we'll have them, acutely managed at home right after surgery. They'll be on their medications, and then usually after the first 3 to 4 days, we want to try to wean them off of that, heavy narcotic, and maybe move them, downgrade them to acetaminophen and use BioWave, and then we continue BioWave along the process. But like I've said, I've seen the cumulative effects of pain management with BioWave, and the more they use that, they tend to feel a lot better. Again, comfortable treatment. We've seen that with knee scopes as well. So typically with an ACL, you got a lot of, and most of the surgeons we work with have a bone patellar bone application. So they have a large scar in the front of their knee. So we just try to get that knee feeling better. Typically apply medial lateral joint line, a scope, same thing, where they're going to have portholes, on the medial lateral sides. We use it in that conjunction, in conjunction with that as well. I like to use it in conjunction with modalities too, initially with ice and things like that, just to try to make as many opportunities that cut pain as possible.
Great. Thank you. That makes total sense. Second question that's come in is, what is the length of time your athletes get pain relief for following the treatment?
Again, from my clinical observations, I see that the longer we can use BioWave, up to that 30-minute time frame, is also correlated with the pain relief. If we do it for less, it seems to be a little bit less. So I try to maximize 30 minutes of time. Usually I'm seeing like 4 to 4 hours, 6 hours of time where they feel diminished pain. I would say that it's not always completely gone, but we've been able to minimize pain enough for them to function through a 2-hour practice or something like that, especially in chronic cases like my turf toe example. And I think obviously as this is research, it'd be nice to see, kind of what those averages are over time. But just my experience is probably around the, 4 to 6 hour range.
In chronic pain patients, the VA on data on over 1,800 patients, we're finding that the average duration of pain relief is about 8.3 hours in those types of patients. I would assume, like with athletes, you're getting some residual pain relief, and then if they go out and they re-aggravate their condition, you would need to use BioWave again, obviously.
Yeah, and I think their probably activity levels, obviously I'm just thinking of a VA patient versus, what their activity level is at the time of, use or whatever. So we're seeing that, especially with someone who's active, I think a little bit less time, meaning that they're participating, but again, from a post-surgical standpoint, and they're not able to move their knee a whole lot, or they're, in an elevated state, resting in the, first 2 weeks of their post-surgical care. Again, they're still getting benefit from that.
Great. Next question that came in is, how easy is it for the athlete to use the device?
Yeah, so I think that's one of the biggest benefits from my experience. I mean, I feel very comfortable just kind of turning over the device to the athlete. Literally, you got to teach them about pad placement and how to turn the thing on and turn up the intensity. So they don't have much to remember. I mean, we know all of our athletes are very intelligent individuals and that they can handle more, but the fact that it's simple keeps it easy, and it gives the clinician confidence that they're not going to mess it up. There's not a lot of parameters to pick from, et cetera. So not only the easy use of the device, but just how mobile it is. Your home and go units are small, so they can easily be transported easily. And they like that a lot. So we have them taken into meetings. We have them, at home. We have it, on the road, et cetera. So I think that's a big benefit of the device itself.
Great. Well, pads go directly over locations of pain, power button and plus button to turn up the intensity to manage your comfort level. So glad that you're finding that it's easy to use. Next question is, what is the BioWrap and what are the applications? Actually, I think I'll take that one. A BioWrap is it's our wearable compression electrode garment. It allows us to treat up to 5 times the volume of tissue as compared to a conventional 2-inch round hydrogel electrode. And the patient gets the benefit of compression simultaneously while the device allows the delivery of our high frequency neurostimulation into deep tissue. It also, we use a proprietary silver fabric technology that's fixed within the compression device. And so there's no guessing as to exactly where the electrodes need to go. And they are designed to last for at least a year. And so they're very easy to use. We have one for the lumbar spine. We have BioWraps for the foot and ankle. We have a circumferential electrode that goes around just above the ankle and one that goes around the foot. Great application for high ankle sprains in sports. And we also have a knee BioWrap that treats a much larger volume of tissue. So you're covering everything from the anterior of the knee to the lateral and medial side of the knee, and you're getting compression around that as well. We also have a thigh and calf, so you can treat literally the entire hamstring, the entire quadriceps, IT band, anywhere around the thigh, as well as gastroc strains on the calf or anywhere around the shin or other parts of the lower leg. I think it's a better way to treat severe acute or chronic pain. And again, they're wearable, and this whole new family of devices we call BioWraps. Next question is, what are the applications and benefits of using the back BioWrap specifically in football athletes? Actually, that's a good lead-in for you, Nathan, if you have some experience with that.
Yeah, sure. Well, the lumbar BioWrap, I mean, is for, say an offensive lineman, a lot of them have some chronic low back pain, et cetera, sometimes acute low back pain. But the biggest thing I'll tell you, you're not tethered to, a wall unit, or a big, Stim box, that has a bunch of different waveforms in it, so what you're seeing here is that the patient can come in, get treatment, go through the rehab. They can continue wearing that. They can wear it out of the facility into their meeting. They're on the field and maybe they're hanging out watching. They got some nice compression and support from the back wrap, as well as the pain management with BioWave. So I just see, again, it's very mobile. Again, it's easy to put on. The electrodes are in the right place. Gives them a large coverage area, and we've had a lot of really good success with that.
Oh, great, thanks. Next question that came in is, have you noticed a change in the amount of time it takes to heal the damaged area after using BioWave?
So I think that's a tricky question, just because I think biology is going to kind of take its course and everybody heals differently. But what we have seen is pain reduction. So I think pain reduction correlates well with moving through a rehabilitation process quickly and restoring range of motion and maintaining strength, et cetera. So if we can get that pain level down, especially acutely, as soon as possible, the athlete is much in a better place to move forward with exercise and therapeutic intervention. So do I have data that supports a quicker healing time? I do not, but I do, anecdotally feel that the athletes are moving quicker through their process, just because pain management is effective.
So I would just add that where the active electrical field forms beneath each of the two electrodes, it forms in a hemisphere. Think of like half of a grapefruit, that size volume of tissue. There is increased blood flow, and it's not from vasodilation. It rather components of blood have a charge associated with them, and when a charged particle hits an electrical field, it has to be accelerated through that field. So we do see increased blood flow through that volume of tissue. So not from one treatment, but if an athlete's using BioWave over weeks with multiple treatments a day, if that particular injury that they're trying to rehab from can benefit from increased blood flow, then we do tend to see a cumulative benefit with treatments over time. So, if we're talking about like in a VA setting, I'll just go back to that. If you have a patient with a mechanical issue like osteoarthritis of the knee, the electrical field that's generated inside the knee is not causing cartilage to regrow. And so we're not going to see a cumulative benefit over time, even though BioWave is an excellent tool for managing pain in patients with OA of the knee. So anyway, that's a little bit on the mechanism of blood flow through a joint or location that's being treated, and how that might relate to healing. Next question that came in is, in what other sports are you using BioWave, and what are some examples of injuries that you might treat in other sports?
Yeah, just to reiterate what I said, I mean, at Towson University, we have 19 varsity sports, everything, soccer, baseball, softball, field hockey, football is obviously where I'm kind of housed, and I take care of a lot of football athletes, but I mean, lacrosse, basketball, I mean, we have all of those. So all of those sports bring acute and chronic injury. All of our facilities on campus have BioWave units. We have the ability to have those treatments done in the facility part of the rehab and on the go for them to take home, et cetera. So to answer the first part of the question, all sports at Towson University, and I think any sport application is appropriate. And if you have an injury or a pain, it can be used. And other types of injuries, I mean, again, anything from, just talking about the types of tissue we deal with. So sprains or ligament injuries, strains or muscle and tendon injuries, contusions or bruises to soft tissue or bone or ligament, even healing fractures, anything that you need to provide pain management, I think BioWave is appropriate. So ankle sprain, knee sprain, patellar tendonitis of the knee, hip flexor strain, quad strain, hamstring strain, shoulder sprain, all of that, it can be used. So low back pain, low back sprain, disc pathology, et cetera. So just to run through a list of, I mean, as a clinician, your creativity and how you use it is endless, in my opinion.
Thank you. Last question that came in. Where do you mostly use BioWave? And it's not necessarily, for example, a training room, during meetings, bus plane, hotel room, at home, sidelines, that type of thing. Or it's a little of everything, I don't know.
Yeah, it's everything. I mean, I think it's just wherever the application most sees fit. I mean, typically, it'll be in the athletic training facilities where, we're managing acute injuries. That could be immediately following an injury, such as someone sprains an ankle on the field and they get carted off, and we bring them to the facility and we're evaluating and we're treating them acutely until they are seen by a physician or get an x-ray. We use that. I mean, I've used it at home post-surgically, where we make sure that those athletes are set up, with the right equipment as they head home after surgery with their parents, and to use that on their body part that had the operation to manage pain. And we've seen it, post game use, so I think, again, being that it's mobile, it can be used anywhere. But I'd say, probably, 50% of our kids are using it in conjunction with our facility and around their downtime prior to practice or after practice, and we just pick and choose kind of who needs to go home with one, just depending on how acute and severity wise and how important it is to move that person through that process as quickly and safely as possible.
Makes total sense. That looks like it's it. So thank you. We really appreciate you acting as our guest lecturer this month. I thought it was a great presentation. I thought we had some good questions here in the Q&A. And I'll look out for our next webinar, third Tuesday of the month.